get oxygen in the required amount, which is actually required by the body. So treatment lies where? Treatment lies in giving the oxygen externally. So these patients, they actually take up oxygen at home 24 hours. They are on oxygen. They even move about. You can move about with an oxygen cylinder with you. But it's a debilitating disease and no cure is there. Actually, you cannot revert it also. The only thing what we can offer is to have a better quality of life in terms of interstitial lung disease, and lung transplant is the only answer for this. What else? More patient, एक और second. In interstitial lung disease, more of the people, they are predisposed that we have got this mining people, those who work on the roadside or the sandblasting unit. In radio, like underground working, where you got radiation to the radon and all. ये है radiation. और इसके बारे में lung cancer.
I think
on preventive health checkup related to kidneys.
related in laws,
Kidneys. And this is the main part, and how frequently it depends. Okay.
So, yeah, of course. So, do I need to ask questions or
You just ask.
just considering kidneys and in nephrology specialty?
Definitely, as you have asked that important question, that this prevention is it's way better, because once the kidney failure or kidney disease has occurred, it's very difficult and very complicated disease and very difficult to handle. It's very costly treatment also, so it's definitely very important to prevent.
So, sir, if you could just tell what are the most prevalent problems one faces and
As far
according
as-
to various age groups?
As far as kidney disease are there related age groups, the common diseases which occur in children, there are congenital problems. In the later age group, there are some diseases known as those are reflex nephropathy, and in later age groups, diabetes and lifestyle modification problems related kidney problems are there, and other diseases like renal stone disease, then hypertension related disorders. So these are the very common kidney problems related to age.
So, would you like to recommend a
Important test by which we can diagnose any patient with a kidney problem is a blood test, that is serum creatinine. That is a very important blood test which tells us about how much the kidneys are functioning. Second is simple urine test, and third is ultrasound or CT scan by which we can see the kidneys how they are. So these are the very important tests, and to whom patients we should check all these tests. The patients who are having high risk cases like diabetes patients, elderly patients, patients who are having family history of kidney problems, any history of stone disorders, and diabetes and hypertension patients. So these are the patients which should regularly go to preventive health checkups related to kidney specific blood tests and urine tests. So it depends that in patients with diabetes, they should get checked at least annually basis. Others who are having normal blood test or urine test, they can go for 2 to 3 yearly intervals. And these all are preventive health checkups are available on Healthians and PSRI website.
Hi.
See, prevention is always better in every sphere of life, more so at medical line. And I, being an ophthalmologist, will definitely recommend prevention is better than cure. There are so many conditions that if diagnosed in time, we can take precautionary measures and save big time. There are certain conditions in eye, let us start with the kids only. There are certain diseases that if we catch them early, by just going to the eye clinic, to the ophthalmologist for a checkup, and if diagnosed in time, we can save child's vision. And that's a big thing. Right? There are certain conditions known as amblyopia, or what we say in a layman language, lazy eyes. If we take our child to an ophthalmologist for a general checkup at about an age of 1 to 2, between 1 and 2, even if there is nothing, there is no problem with the eye, we can diagnose these things. The pediatrician, the pediatric ophthalmologist can diagnose these things, can take corrective measures which are very simple in nature, and then child can have a very good life later on. Because these are the things which can be cured only initially in 7-8 years of life. After that, they have a permanent blindness or permanent loss of vision. Similarly, in conditions like glaucoma, which is a deadly disease, a silent thief of vision, right? If somebody has a history of glaucoma, somebody in the family is having glaucoma, somebody has been diagnosed as glaucoma, we say it is very imperative that take glaucoma checkup very seriously. We recommend that even if somebody is not having glaucoma, just have an eye checkup at around 35 to 40 years of age. And if somebody has a glaucoma in the family, we will say to come and check up 5 years, 10 years early. And then have a regular yearly checkup, at least for those who have a history of glaucoma. Because the nerve damage done by glaucoma can never be replaced back. So if we have glaucoma or we diagnose glaucoma early, we start the treatment that is very simple in the form of medications initially, we can save the vision. Similarly, if we jump to retina, which is my specialty, like any patient who has diabetes, we recommend that to come for a checkup yearly once, but patient don't take it seriously. They will come only when they have some symptoms. That is what we like recommend, that you have to come early, you have to take preventive checkups. When you are diagnosed as diabetic, come for a checkup yearly even if you don't have any problem. Because when you come with a problem, it becomes difficult. The damage which is done cannot be replaced. If we are diagnosed again in time, we can do certain things, we can guide you, we can do some lasers, and your vision can be saved. We see patients when we prescribe them checkups early or lasers early or some kind of treatment early in their early stages of having diabetic retinopathy, they don't take it seriously. Then they will come 6 months, 1 year, 2 years down the line, they will say, do something sir, save our vision. And it becomes little difficult, both for us and for the patient. And whole family life get disturbed because of this. So these are certain things that we recommend for child, for glaucoma patients, for diabetic patients. All these things are extremely important.
So, on like if I talk about on regular basis, what are the most common or the most prevalent eye problems you face in your patient? They come up, they complain about that. This is the most common. Like what according to most common problem you've been treating your patients of.
See, most common problems are the refractive errors. Layman language, refractive errors are the number of glasses.
Okay.
Patient don't see properly, but they don't care.
Mm.
So if they come for a checkup and they have eye problem or they're not seeing properly, just come. If they have to prescribe glasses, they can wear glasses or contact lenses, whatever they feel like. This is the most common problem that we face. Second things are in a older age group, which we cater most importantly, are the cataracts.
Yeah, that's right.
But cataracts will affect the patient vision, so they will come at some point of time or the other, right? Third important things are now which is catching up is diabetic related eye damage, that is known as diabetic retinopathy. So these are the common eye diseases apart from other which are glaucoma and other certain things.
Okay. So, like of lately, we've been a lot hearing about glaucoma and everything. So, how, at what pace, at what rate is it increasing, and how the number is rising? So, would you
See,
like to-
glaucoma is not increasing or it is not increasing in pace. The awareness has increased and the diagnostic modality has changed over a period of time. We are now better equipped to deal with glaucoma. The diagnostic modalities are that we can catch the glaucoma early. And now with all the media, the social media and all those things, patients are now aware.
Okay.
So these are the things that we are getting more patients of glaucoma, more patients are being diagnosed with glaucoma, patients are also aware. So that is in a sense increasing the volumes of glaucoma patients or certain things.
So, in a nutshell, if you really have to tell your patients that these are the checkups I would really recommend, as to you should get it done on very regular and frequent basis in order to avoid some serious problems, serious eye problems. So, what would those checkups be?
That I have already explained. For the children, I recommend every children should be checked once in between 1 and 2 years of age, irrespective of whether he is having any problem or not. Then any kind of family history of any eye related problem, checkups are must.
Mm-hmm.
In diabetic patients, we recommend a yearly checkup as soon as the diabetes is detected. Then in glaucoma patients, even if there is no history, 40 years is at least one should get yourself checked at once, because presbyopia, that is the glasses for near vision, also develops at that time. And if there is any history of glaucoma, we recommend a first checkup between 30 to 35 years of age at least.
Can you just end it by saying that these checkups are
Yeah, all these checkups which we have told you are available at Vasan Eye Care. There are so many centers in Delhi and Healthians.com.
Preventive health is important, and prevention of disease is important to avoid the avoidable expenditure on the management of diseases which are very costly. There is a provision, and over a period of time in healthcare, good practices have been developed about positive health checkups. And through this, there is a possibility of the early screening of the diseases which are fatal. It prevents the time, it prevents energy, it prevents money of the patients. More important from the prevention of the diseases is the promotion of the health. Probably we have been all the time talking diseases, and we have forgot to discuss health, which is very basic. And for the promotion of health also, again, on account of the aggressive lifestyle which we pursue in this age, irrespective of the age, whether students or even school students, even the working group, whether ladies or gents, and even the elderly people, we all miss on our very balanced way of life, balanced diet, balanced exercise, balance in different aspects of the life. And on account of preventive health checkups, it gives us an insight that if there is any nutritional deficiency, or if there is any deficiency which can be overcome by the appropriate corrective measure, and then it can help in the better productivity, personal productivity, professional productivity of the individuals. So preventive health checkups is a boon in this direction, and it definitely helps the people to look to ensure their health, and to prevent the diseases and to screen them timely, which is probably very cost effective, and it is a matter of social awakening and health consciousness.
So, sir,
That preventable diseases in the childhood are the nutritional diseases. In the early childhood, it could be the blindness which could be prevented, which is due to the deficiency of vitamin A. Then rickets, osteomalacia, that type of the disease on account of the deficiency of vitamin D. Of course, it is associated calcium deficiency. Most common in third world countries, which includes India also, are the protein deficiency or the protein energy malnutrition, PEM it is called as. So it gives poor weight, poor health, poor muscles of the body, and of various grades depending on the type of the deficiency and at what age it has started. Then in the productive life for the females, again in the reproductive life, there could be a deficiency of the different vitamins, especially minerals, iron, because you see that they have to feed children in the reproductive age, and on account of the menstrual cycle there is a regular loss of the blood. If it is not replenished by the good supplements in the diet, then it can result into deficiency, and there is no casual way of finding it except the tests. That is a very simple hemoglobin test of the blood. Similarly, in the elder age group, deficiencies related with the again protein, vitamins, which lead to the memory loss, which lead to the poor functioning of the nerve conduction, etc., etc. They are related. In the elderly age group, the deficiencies are passive. They are on account of certain addictions like alcohol, maybe on account of the tobacco chewing, on account of smoking, on account of certain other very personal and deviated food habits. So that nutrition may suffer, which may lead to the poor health. At the same time, different nutritional deficiencies. They may be of neurological system, they may be of blood or vascular system, etc., etc.
so So,
You see that to prevent diseases and to identify the deficiency at the right time, Government of India and number of the countries for the children, they have got school health programs, and in the school if annual checkup is conducted for the children, a good number of the diseases preventable and which help them in doing better at their studies and in the field of the games, they could be found out by the routine school health checkups. Then for the working or the elderly group, I personally feel that good number of the organizations now these days, particularly corporates, they have a system of executive health checkup in which they ensure that the workforce and the managers who are working with them, they are mentally, physically fit, and to ensure this, they ask them to have complimentary health checkups every year. Of course, complimentary means they are funded by the parent organization. But this very minuscule expenditure is worth doing to ensure the right health, right productivity, right type of the mental faculties and mental health of the working executives. Health of the ladies is of a great concern, and executive health checkup of the corporates is one aspect. But I personally feel that socially, professionally, there should be more publicity and more awakening and more education about that all sectors of the society to have their health checkup at least once in a year. If they undergo that, male, female all together, they will be able to update about their health all the time, and corrective measures, whether it is a nutritional supplementation or it is a vaccination against the prevention of certain diseases or certain therapeutic diets. Suppose if they have caught up with certain diseases like lifestyle diseases like hypertension, like diabetes, like obesity, like cardiac diseases, like some mental physical diseases like anxiety, sleeplessness, etc., etc. All these things can be very well addressed by the timely checkup